Good afternoon, and thank you for joining us for today's webinar, Improving Relationship-Centered Communication for Nursing Students. Before we get started with today's presentation, I have just a few housekeeping items to run through. Today's webinar will be recorded, and a copy, along with the slides, will be sent out to all registrants at the conclusion of the presentation. Attendees are in listen-only mode. However, if you'd like to chat with us or ask us a question, we encourage you to do so using the GoToWebinar control panel on the right-hand side of your screen. And if you're on social media, we invite you to connect with us by tweeting @Cognito or using the hashtag CognitoWebinars to continue the discussion online. Finally, before I turn things over, we'd like to take a quick poll of the audience on the line. We'd like to know, how is therapeutic communication skills currently taught in your program? Is it done in a dedicated course, embedded throughout, not explicitly taught, it was covered in undergraduate work, or you're unsure and would need to explore further? So we'll let everyone come back to the screen and vote. A couple more seconds on the poll. All right. So it looks like 75% of the people on the line have a dedicated course in their program to teach therapeutic communication skills, and 25% have it embedded throughout. So hopefully the information that we provide you with today can help you in teaching therapeutic communication skills in your program. And now I'd like to introduce today's presenter. Dawn Marie Borenheimer is a published author and industry leader with a unique combination of interpersonal communication skills and partnership development with a focus on education and social impact. In her 18 years of professional experience, she's worked at Johns Hopkins Bayview Medical Center in their psychiatric rehabilitation program. She taught for 5 years in the Baltimore City public school system and facilitated business development initiatives for Kaplan Test Prep, Capella University, and NYU Langone Health. Joining the Cognito team in March of 2019, Dawn currently serves as the Director of Clinical Health Partnerships. And with that, I'd like to turn things over to Dawn.
Thank you, Scott, and thank you everyone for joining us today. So we're going to take a look at how therapeutic communication skills can be taught with your nursing students using Cognito simulation and the compatible resources we've developed with subject matter experts. As you know, simulation means a lot of different things to different people, so we're going to spend a few minutes talking about virtual human simulation. We're going to take a quick look at motivational interviewing, and then we're going to dive into the simulation itself and what it looks like to use simulation in your classroom using the Cognito resources. We have information for pre-brief, as well as simulation overview, and then we're going to talk a little bit about the facilitator guide that we've built to help you with the debrief discussions that you can have with your learners. So at Cognito, we use the power of conversation in the virtual human environment to improve social, emotional, and physical health. These are some of the avatars that you will see in some of the simulation content that we're going to present today. The goal of each simulation environment is to create as realistic of a client encounter as possible. And so we're going to show you simulation that involves human interaction with an emotionally responsive avatar while you play the role of the provider. So the benefits of virtual humans really focuses on this idea that we can reduce the anxiety created by the virtual environment within the virtual environment. So it makes it a little bit safer for learners to engage. They have an opportunity to experiment, to try different conversation pathways. They have an opportunity to be a little bit more honest, perhaps with the way in which they're engaging. They're going to receive an opportunity to receive unbiased feedback. And they're going to decrease the likelihood of transference. If I were sitting across from a peer to do a role play, there would be an element of judgment, perceived or not, that they would know what I'm supposed to say. And so I have an opportunity now to engage in this environment one-on-one, which is going to decrease my anxiety and really allow me to be more present for the learning experience. Receiving the unbiased coaching within the platform also allows it to be in time based on my own engagement. So it's a little more personalized than it would be if we did an in-person role play And therefore, it allows me to change not only my level of confidence and self-efficacy, but basic attitudinal change that allows me to be more engaged with these skills going forward in my everyday interactions, including my client encounters. So when we talk about evidence-based conversation skills, we really hone in on relationship-centered or patient-centered conversation and communication skills. So taking a look at this wheel, oftentimes we show this to our clients to help them understand some of the skills that we're focused on. And so you're going to see a lot of information related to expressing empathy, asking permission before engaging in some of these questions and topics, especially around screening and brief intervention. There is a model that we want to use, a framework that really allows us to earn the right with the client before asking some more difficult questions. We want to be very clear and reflective as we explain what we're going to move into next, really allowing them to be a part of that conversation and feeling that they are being seen and heard through every step of the engagement. And so using these relationship-centered conversation skills, we have an opportunity to move a client from sustained talk to change talk, to ultimately be motivated and to be a part of the next step in their care plan. So we're going to take a few minutes and we're going to look at this conversation. This is a didactic with an avatar named Danielle, and Danielle is going to guide us through a few minutes of motivational interviewing. This is relevant as a didactic component that is offered separately from a virtual encounter, as well as used as an add-on for some of our clients, because they want to explicitly teach motivational interviewing prior to expecting their students to move through it in a virtual encounter. So we're going to just listen to a few moments here.
Hi, I'm Danielle. I work in a psychiatric rehabilitation program, and I've recently learned a new way to talk to patients about healthy lifestyle changes, a communication style called motivational interviewing, or MI. Using MI, any healthcare professional, from doctors and nurses to dietitians, therapists, and other staff members, can guide patients to recognize their own reasons for change, which can motivate them to make plans to commit to change. Today, we'll go over some MI techniques and prepare you to use them when speaking with patients with serious mental illness. While there are many MI techniques you can master, the overall approach is simple. MI is a way of being with patients and treats decisions about change as a conversation, not a prescription. We listen to patients with empathy and partner with them to work through their reasons both for and against change. What we find is that most patients don't resist change because of lack of information, but because of genuine ambivalence. Using MI, we can guide them to address both sides of their thinking and ultimately come up with a plan about change that they're motivated to follow. In any conversation about change, you'll hear some statements that are pro-change and some that are counter-change. Pro-change statements are called change talk and indicate that even in some small way, the patient is contemplating change. Research shows that the more patients talk about changing, the more they do change. Counter-change statements are called sustained talk because they indicate a desire to sustain the status quo. Sustained talk comes in the form of statements like, to guide people towards change, you should reframe or de-emphasize sustained talk while eliciting and building upon change talk. Listen for change talk that expresses an explicit or implied desire, ability, reason, or need for change. Here are some examples. You want to explore these kinds of statements with the goal of eliciting.
So we're going to go ahead and move back into the presentation, but I just wanted you to be able to see just a few minutes of what a didactic would include. And so as I mentioned earlier, you know, the goal of the conversation oftentimes is to move from sustained talk into change talk. And so by using motivational interviewing, we have an opportunity to help the client or patient to engage in those conversations, allowing us to have them move in the direction of making some shared decisions with us. So we've been listening avidly to the field, and when we talk to schools of health professions, specifically nursing, these are some of the things that come up in our conversations. And so my colleague Brooke and I talk to clients on a pretty consistent basis, and what we understand from them is that nurse leaders are, confirming that it's difficult to obtain in-person site clinicals. Both for adult and pediatric for their nursing students. And honestly, I was hearing this feedback back when I worked at Kaplan. I was hearing this feedback many, many years prior to now, so pre-pandemic. We know that this has been a challenge in many areas, and so it might have been amplified during this time. Others, say that simulation doesn't really offer them the opportunity to practice person-centered care conversations. So there are a lot of really great simulation tools out there, but virtual human simulation and the ability to practice conversations makes us unique and different. The ability to reflect and to really think about your answer choices, to learn from them in real time, and perhaps to make some different choices based on that information allows us to move in the direction of more compassionate care. And lastly, students don't get enough experience with evidence-based screening tools, prioritization, brief intervention for mental health or substance use. And so by giving them that practice to build their confidence, they can really take the skill to the next level when they do have the opportunity to engage in real life. So now we're going to step into what is considered kind of a preview of a facilitated session. As I mentioned earlier, we have some really fantastic resources that complement the simulation, one of which is a facilitator guide. Each of our clinical simulations offers a facilitator guide that opens with a menu, if you will, an overview of how you could facilitate either a live facilitation or a self-directed facilitation. You have the opportunity to decide if you want the students to complete the simulation before and then engage with you in a debrief discussion, or if you wanted to do a little bit of an opening with them using some pre-brief resources like a learner takeaways that I'll show you, and then move into the simulated experience independently and then proceed to the debrief discussion. So there's a lot of options, and we offer those to you in the guide so you can explore them in your preparation, but so you don't have to build out the surrounding resources that would complement the simulation. So today we're going to take a look at SBI with adolescents. There are two in the series, both of which we developed with NORC out of the University of Chicago. SBI with adolescents, the image here on the left side, is the first of the two in the series. And we're going to take a look at the second of the two in the series today, which is SBI with adolescents, comorbid substance use and mental health, which released in the fall. And the reason the second simulation came to be is we heard a lot from different nursing schools, programs of social work, and even professional counseling. They were very eager to see a less compliant co-occurring case. And so we took a look at what we were able to accomplish in the first simulation set, and we were really able to show you how to use validated tools. And now we wanted to really tighten up your use of those validated tools in the second. We were able to help you understand the brief negotiated interview, and now we want to focus on the application of that. And then the use of motivational interviewing skills, and now really the deep dive of applying those with a more challenging encounter. And so these two together complement each other quite well, but we want to make sure that we take a little bit of a longer look at one of the simulations so you can understand how the environment works, and then of course how the complementary resources support that. But just so that you're aware, this one will appear a little bit more advanced because it is the second in a series. So today we're going to meet Zoe. Zoe is a 16-year-old. Her pronouns are listed here, and we're going to talk a little bit with Zoe, who has a persistent cough. Now, we understand through the screening results that she's received that she is screening for moderate depression as well as low suicide risk, which we want to address today in our brief intervention with Zoe. The goals of the conversation will also be shared through the didactic element that you will see, but we're going to spend a little bit more time inside the actual simulation so you can see how the virtual encounters work. In advance of assigning the simulation to your students, we're going to invite you to consider a pre-brief. Using the resources that we provide, Are you able to show them some of these assets that would help them be successful in engaging with the simulation? So going over validated screeners, discussing the steps for the brief negotiated interview, again, available as a PDF, so you could easily give that to your students. And then we're going to take a look at the didactic, which gives a really nice overview of the screening tools themselves and the results of Zoe's screening specifically. And so by doing that in the pre-brief with your students, you're going to set them up for success as they engage with the encounter itself. So now we're going to move into the virtual encounter, so you have an opportunity to learn a little bit more about Zoe. So when we talk with Zoe, we realize that these are the goals of our conversation: to refer to a specialist for assessment and to see if Zoe will cut back on her opioid use. Again, reviewing the screening results that we learned earlier in the simulation, likely moderate depression, low risk passive suicidal ideation, and using opioids without a prescription a few times a week. Reviewing the brief negotiated interview steps is always helpful. They're also going to be part of the feedback that we're receiving while we're in sim. So I think it's important that you call these forward. Again, there's a one-pager that you can share with your students, but also it's a nice opportunity for them to get one more brief review prior to diving into the conversation. And then again, motivational interviewing methods. We want to review the different types of motivational interviewing that we know. This is a counseling style that promotes change, asking open-ended questions, using affirmations, reflective listening, summarizing what we're understanding and learning as we're listening to Zoe, and then eliciting, provide, and elicit. So asking permission, giving some information, and then inviting a response. So there's going to be a cadence to these conversations. We're going to take a few minutes to explore one, but just know that you'll be able to continue with this. If you are interested in seeing a demo, we can send you a full-length demo following the webinar.
Hi, Zoe. I'm a colleague of Dr. Fence. Was she able to help you with your cough?
Not really. Said just rest up, hydrate.
I'm sorry we couldn't help more.
It's fine.
So as we build rapport, the engagement meter is going to begin at the bottom. And I just want to acknowledge the closed captions are on right now, which is found under the menu options. So if you do enter a demo and you don't see that, or if you would like to use that with your students, please feel free. Under the menu, you can just check a box that will allow those captions to appear. So as we select the conversation pathways, we can hit the talk button. It's going to give us an opportunity to either build rapport or discuss use. So let's go ahead and get started with discussing use.
You answered some questions about your health and how you're feeling.
Oh, like the 10,000 questions about drugs and whatever?
That's right. We ask everyone to fill those out. Thanks for answering them.
Sure. Am I in trouble or something?
No, not at all. And everything we talk about here is confidential. Unless it sounds like you might hurt yourself or someone else, or someone might be hurting you, or unless you decide to bring someone else in, I won't share what you say here with anyone. I'm just here as someone who cares about your health.
Okay.
Mind if we talk about your answers?
If you want.
So one of the beautiful features about Cognito is that we want you to be able to hear the internal dialogue of your client at times. And so when you click on the speech bubble up here, the thought bubble, you can hear what Zoe's thinking.
I just came for a cough. Didn't expect to get grilled on some random stuff I said on a form.
As you can imagine, that's a pretty typical response for a teenager. So we're going to go ahead and proceed with the conversation. We did ask for permission. So now let's see where we're going to go next. So the answer choices that you can choose from change, the discussion threads that you have an opportunity to select. So let's take a look at discussing use, and let's pick the first one.
On the form, you said sometimes you take pain meds and other pills. What can you tell me about that?
It's just when we're hanging out, people pass stuff around. It's something to do.
So you use them when you're hanging out. What about other times?
Sometimes take a couple for the road.
So our virtual coach is popping up here at the bottom to give us a little bit of feedback. So used non-judgmental open-ended questions. to discuss this with Zoe. So this is giving us some positive feedback about reserving judgment, which is excellent. Then if we decide to proceed with our next thread, as you can see, the choices change yet again. They adapt based on the way in which I'm engaging.
When did you start using the pain meds?
Maybe a year ago. We were in someone's basement, and yeah, about a year ago.
So again, we're going to get some feedback here from the coach. So as you click that open, you'll be able to read additional feedback. So this is a good place to start to discuss Zoe's use in her past use. And so as we continue to receive this feedback, it'll continue to pop up down here. The engagement meter will also continue to fill itself in. So let's stay discussing use.
You're a good kid. Why are you using pills?
I mean, if someone's passing stuff around, I'm not going to be a buzzkill.
So let's see what feedback we're going to receive now that Zoe's shutting down a little bit. Your question implied you were judging Zoe's choice to use pills. That showed her it wasn't safe to open up. So the coach is reminding us that by the way in which we ask that question, we're kind of causing Zoe to shut down a little bit, and we'd really like her to open up and feel comfortable talking to us. So this is where we have the opportunity to choose the undo button. So maybe that's not for the response we were really expecting, and we didn't realize it until after we had made that choice. So now we're going to have an opportunity to go a different direction. As you can see, our answer choice that we selected previously is now grayed out. We have the option of choosing the other discuss use option, or we have the opportunity to discuss life a little bit.
Well, I'm not sure there is much to say. Sometimes I like to chill out.
I just have a couple more questions. Have there been any times where you started using less or more?
Look, do we really have to do this? Shouldn't you be talking to people who actually have problems?
So this is some pretty strong sustained talk with Zoe, which is any speech or favor the status quo, right? So now she's getting a little frustrated with us. We want to refocus on her health issues and talk about her screening results. So we can reflect, empathize, get information, or share information. So let's reflect back what we're hearing.
You don't feel the pills are a problem?
Not really.
So now we're moving to the second stage of the negotiated interview. So this is helpful. This is giving us some indication that we can keep going. But we're going to check in with the coach and just see what our feedback is here. And then once we have this feedback, we would proceed with the conversation. So right now, we're going to go ahead and move back to the rest of the presentation, but I will be more than happy to provide you with a link to this full-length demo so you can experience the simulation for yourself. And just know that as you move through the simulation, if you think about the process in the way in which your students would, it would give you an opportunity to decide what would you like to discuss most in the debrief. So all of your students have now completed the simulated experience, and now you're going to use the discussion guide, the facilitator guide, to lead some debrief discussions. There are a couple of categories on the discussion section, and I've pulled out one question from each category just to give you a snapshot of what this discussion guide may look like. So you can have a general discussion. You can talk about teen substance use and mental health. You can talk about the brief intervention model, or you can dive into referrals. All of these options are available, and there are multiple discussion questions under each option inside the facilitator guide has been developed with the subject matter experts that assisted with the build of the simulation itself to create a more well-rounded experience for the learners. So the last thing I wanted to touch on in the last few minutes that we have, these are the topics that we have available today that are resonating with our nursing programs. We have topics around mental health, both adult and adolescent conversations. We have topics focused on substance use. Again, you saw the SBI with adolescents conversation set, and we also have opioid use disorder, and then we have an SBI with adults. And then we have some pediatric conversations that focus on nutrition and childhood obesity, the co-occurring, which we demoed today, And then a chronic disease conversation set that's really interesting. We're adding a simulation to that conversation set that will focus on gender affirming care that will be available this summer. So some really exciting things happening in our portfolio, but I wanted to show you a snapshot of the things that are most interesting to nursing programs today. And in the final minutes, if we have any questions that I can address for you, that's everything that we had to share with you today. I'm very grateful for your time and really appreciate you coming to the webinar. I know we have a lot of competing priorities. I'm excited to see that therapeutic communication skills are taught actively in your program and that they're threaded throughout for many of you. I think motivational interviewing techniques, in addition to other therapeutic communication skills, are essential for us to lead with more compassionate care and patient-centered care to increase and improve our better patient outcomes. Scott, do we have any questions that I can answer for the group before we wrap up for the day?
It doesn't look like we have any questions coming in. We do have Dawn's email information on the screen, as well as just the general clinical training email if you need some information specific to your school on pricing or how this integrates into your curricula. We're happy to answer those questions. If there are no questions, give everyone just a minute to return back to their screen. You can use the right-hand side of the screen, the GoToWebinar control panel, to submit a question if you have one. But it looks like in the absence of questions, we will move to conclude the session. Thank you, everyone, for your time, and look out for the recording and the demo link to be sent out in the next 24 to 48 hours. Thank you.
Thank you, everyone. Have a great day.